And we're doing another Facebook Live today, and we are going to be doing a RejuvaPen treatment. RejuvaPen is the microneedling device that we use, and it's definitely one of our more popular skincare treatments that we perform because it is amazing, and it works to tighten and firm and tone the skin, so it's great for skin, more mature skin that's lost its elasticity. But it's also amazing for acne scarring and even stretch marks. You can do it on the body, the face, the chest, anywhere. And people love it because it works really well. So I'm going to be demonstrating on Miranda today, and we've numbed her skin for an hour prior to starting, and I just got her all cleaned up, and her skin is prepped and ready to go. So first thing I'm doing, I'm applying a hyaluronic acid serum all over her face, and this is serving a few different purposes. So it's, first of all, providing slip for me during the treatment so that the RejuvaPen can glide over the skin easily, and then during the treatment I'm creating all these little micro channels, and so I'm going to be basically infusing this hyaluronic acid serum into her skin so it can help her skin heal and plump up and just do all these wonderful things that we want it to do. And Miranda is totally numb. So she can't feel anything, which is strange and wonderful at the same time. All right. So this is our RejuvaPen, and I just unsealed this tip and put it onto the device, and I'm just removing the cap. So each tip is sterile, and it's just used one time, obviously. All right, so I'm going to be starting on Miranda's forehead, and I approach each area of the face as, an individual treatment, basically. So each part of the face, I may use different settings. It really depends on the person and what's going on with their skin. All right, so I'm going to turn on the device, and it sounds a little crazy. But like I said, we numb our patients for an hour before we start the treatment, so you feel nothing. Okay, you ready, Miranda?
Ready.
Feel okay?
Yep.
So as you'll see, there are little tiny pinpoint bleeding spots, and that is exactly what I want to see.
But the patients do not walk out of here bloody.
No.
I mean, it's not like the vampire.
Absolutely not. It's really interesting because the patient, if I didn't say something, I mean, you would never know that you were bleeding, that there was any blood involved, because, they're sitting here relaxing during the treatment and completely unaware of it. And so by the time we're all done and they get up, I've already completely cleansed their skin, and
and it looks like you do several passes.
I do. So each area I make 3 passes, and in 3 different directions. So I do a vertical pass, horizontal, and diagonal pass. And so it really just ensures that the area is completely treated and thoroughly covered.
And Miranda, you're completely comfortable?
Very comfortable.
I don't feel anything.
And, it's interesting because, the forehead is definitely, like the boniest part of the face. And so it tends to be, if not numbed properly, it can be an uncomfortable part of the treatment. But yeah, when you're numbed properly, then it's really no biggie. So a lot of patients are curious about Rejuvepen treatments, but you know, they'll say that they admittedly are pretty nervous and scared and put off by the fact that there are needles involved. And you know, it sounds totally barbaric, but it's really, it's not. And it's a great treatment, especially, you know, for Miranda here, who has skin on the darker side. This is a completely safe treatment.
So it's safe for all skin types?
Exactly, yep. Safe for all skin types and skin colors, and even sensitive skin, even somebody with rosacea. You know, I customize the settings for each patient, but for somebody with rosacea, this is actually a really great treatment because, as I was explaining, I'm creating these little micro channels, and that triggers the wound healing response in the skin. So when the skin is healing itself, it's actually creating healthy new skin cells and healthy new blood vessels, which is pretty amazing.
Like aerating your lawn.
Like aerating your lawn, exactly. That's exactly what it's like. And so this is also one of the reasons it's a really popular treatment is because it's one of the only ones that I can go right underneath the eyes.
Oh yeah, and we all have lines.
Oh yeah. Feel okay?
Yep. She's not flinching.
It requires a lot of trust.
And it is best in a series?
Absolutely, yep. So, you know, it's a process. So doing one treatment, you know, you're definitely going to see some results. There's going to be an improvement in just the overall appearance of the skin. But, you know, as I mentioned before, that whole wound healing response that I'm triggering, that whole process takes about like up to 2, maybe 3 months in total. So that means that up to 2 or 3 months following one treatment, your body, your skin is producing, you know, new collagen, new elastin, blood vessels, healthy new tissue. So you need to do, for most people, you need at least 4 treatments, and we space them about 4 weeks apart. And that's for the face, neck, décolleté. So for treatments on the body, more would be necessary because the skin on the body is thicker than the skin on the face, obviously.
Yeah, so you mentioned it was good for stretch marks.
Yeah.
So obviously that would be on your body.
Exactly. And it really is like a miracle when it comes to stretch marks. Think of it like as an eraser. And they can be pink stretch marks, they could be white stretch marks, you know, kind of silvery. It doesn't matter. And it doesn't even matter how old they are. They could be super old. I prefer to treat stretch marks that are at least 6 months old. Closer to a year is even better. I have, you know, good success with stretch marks that are kind of finished changing, you know, because they do change color and texture and appearance over the first year. But yeah, so it's like an eraser.
So would those individuals, if you're treating stretch marks, need more like 8 treatments, or?
Depending. Yeah, it definitely depends. So obviously, you know, like a younger patient, when I say younger, you know, like a teenager, even into 20s, they're going to heal faster and, you know, better, basically. So they would probably need less treatments than someone, you know, probably like, let's say 30s and up. But most of the time, let's say for stretch marks on the abdomen, for instance, like probably closer to 10 treatments. But I mean, when you think, that may sound like a lot, but when you think about it, like there really aren't any other options to successfully treat stretch marks, especially on skin of color, there really are no other safe treatment options that, you know, you don't risk scarring, marking the skin. So yeah,
And someone with darker skin would not need to worry about scarring.
That's correct.
With microneedling.
Yep. So with the device, I control the speed and the depth of the needles. And so I've had people ask me before, you know, am I gonna produce scar tissue? And
oh, that's a great question.
yeah, the answer, it is. It's a great question. The answer is no, because I'm doing it at a very, very targeted depth. And even though I can control the depth of the needles, it's something that is, you know, it's been studied, and this device has been designed around, when used properly, you know, it's going to stimulate that collagen, elastin, but it's not going to produce scar tissue. So that's one issue with, you know, it's really important that you have a treatment only performed by somebody who is well trained and in a medical setting, because you know, in the wrong hands, you could certainly over-treat the skin, and it's just gonna kind of, you know, basically traumatize it. And, you know, we are creating wounds, but controlled wounds. So when you take it a little too far, yeah, you absolutely could run the risk of creating scar tissue.
And do acne scars, depending on what type of acne scar they have as well on the face, does it typically take more than 4 treatments?
So
that's a little bit of a variable as well.
Yeah, definitely. So yeah, I mean, you exactly like you said, depending on the severity of the acne scarring, it could take more or less treatment. So typically, you know, it takes at least, let's say, 6 treatments, and, you know, it could go up from there. But, you know, as I explained, I'm doing 3 passes over each area. And so if a patient has acne scarring, you know, most commonly on the cheeks, I would do my 3 passes, and I'll do a demonstration of this, but then I do a different technique called stamping. And so stamping, here, I'll show you. So stamping, typically I will increase the settings, and Miranda doesn't have a single line or anything on her face, but let's pretend she does. So stamping is targeting, let's say that she had a line here. So I'm doing just targeted stamps right on that problem area. And that's what I would do around or over acne scars, and it would, you know, stimulate more of a response there.
To rebuild and remodel those.
Exactly, yeah. And that's something also that's unique about microneedling. You know, most of the other treatments to target acne scarring, they exfoliate, you know, so it's shedding, exfoliating the skin. But this instead is just building up your own skin. And so, you know, another question that I frequently get is how often or how long do the results last? And the answer to that is, you know, you continue to age naturally. You can kind of look at this as like turning back the clock some. So, you know, if you take excellent care of your skin at home, and you wear sunscreen and, you know, just do all the things you're supposed to do, then you're going to be in good shape. And as far as maintenance, you know, I do recommend, at least for the face, you know, I recommend doing, like after you complete a package of treatments, I do recommend coming in maybe once a year. Like for Miranda, I'd say once a year, because she's
after completing
6 or 8, yeah, after completing however many sessions it's determined that you need. Then you'd want to come in just once a year for kind of, you know, a maintenance session. More mature skin, I would recommend coming in maybe twice a year. But yeah, again, like with the proper home care and sun protection, you should be in good shape.
And what should Miranda expect to see tomorrow?
So,
will she be dry?
Yeah, so the day of, the skin, you usually look like you have, you know, a moderate sunburn. And then the second day, there's usually a little bit more inflammation on the second day, and I always describe it as like it's like you'll notice it. It's not super noticeable to other people, but you know, on the flip side of that, your lines, scars, everything, they're completely plumped up because of that inflammation. So you know, a lot of people still will have some redness or pink, and that's totally normal. And then over the next...
But her skin won't be sore or
no,
anything like that.
No, it shouldn't be sore. The day of, it's really common to, you know, feel some heat coming from your skin. But also when a patient purchases a series here of Rejuvapen treatments, they also receive a post-procedure skincare kit. And so the products in that kit are, you know, are handpicked to help any discomfort and to help make sure that the skin heals exactly how we want it to for the best results possible. So yeah, there's some, if like, you know, you feel any...
Do you have any flaking? Or...
Yeah, so as I was saying, over the next like 5 to maybe 7 at most, but usually closer to 5 days, your skin's going to go through a few different stages of healing. So most likely your skin's going to start feeling kind of tight and dry, maybe a little bit itchy, and so that's when you really, really want to just hydrate it like crazy. There's no such thing as overhydrating your skin after a microneedling treatment, because it's gonna just allow it to heal exactly how we want it to. So it's possible some people may experience, you know, it definitely depends on how aggressive the treatment is, but some people may experience some flaking, but oftentimes it's really just, it feels tight and dry. And if you're using the post-care products, you know, like you should be, then you may not experience flaking. So it really depends on how aggressive the treatment is. But so then your skin looks amazing.
We actually have a question.
Yeah.
Does microneedling help with wrinkles?
Oh.
Which I believe we probably talked about that a little bit. Let's talk about it again for Brenda.
It does, Brenda. It indeed helps with wrinkles. So, as you can see, and yeah, I'll go over this again. So as you can see, as I pass over the skin, I'm creating these little micro channels, little micro wounds, and I'm also infusing it with some hyaluronic acid serum. So what's happening, and what's going to continue happening as Miranda's skin continues to heal, I'll stamp over here because I did the other side, her skin's going to, I'm triggering the wound healing response in her body. So her skin is going to go into serious healing mode. Yeah, so it's going to create a lot of collagen, elastin, you know, it's going to plump up her skin, and instead of exfoliating and removing skin to get those results, we're just helping her skin rebuild itself. So it is, you know,
definitely great for lines, and
it's fantastic for
what
lines.
if you have facial fillers already in your face?
Good question.
Would you be able to microneedle over the top of this?
Absolutely.
So say I had voluma in my cheeks or Juvederm around my mouth, is it safe to treat over the top of fillers, or could it be used in conjunction with the filler to all over skin rejuvenation?
Yep. We definitely like to kind of bundle the two together because microneedling, depending on the skin and the lines and, you know, whatever the shape the skin is in at that time, it may be necessary to do microneedling to really, you know, to plump up some of the lines and
to get rid of more of the superficial lines.
Exactly,
and
but then,
fillers.
yeah, exactly, and then possibly do Botox or fillers. And if a patient already has Botox or fillers injected in their face, it's really not a problem.
So we're not damaging it.
Nope, because
so
yeah, the needles
deeper
don't
down.
go deep enough to even get there. And with Botox, so after a Botox treatment, we wouldn't, like we would do, if somebody wanted to do two or both treatments on the same day, then we would just do the microneedling first and then the Botox second, because once the Botox is injected, or filler really, we don't want to treat the area or the skin and for, I think we wait 7 days, just, you know, just to be on the safe side. Nobody wants to mess with anybody's filler or Botox. But yeah, they're often used together, and you can definitely do either or. And
in combination.
And in combination, exactly.
So
So
now-
right now, I finished treating all of the areas of Miranda's face, so now I'm just gently going over her skin to clean up any of the blood that's left over. And then Miranda is in about 2 to 3 hours after the treatment, Miranda's gonna wash her face just with a gentle cleanser and pat it dry. And this is just to ensure that we're keeping her skin super clean. And she's gonna start applying some hyaluronic acid serum and a really nice healing moisturizer. The products that we use during the treatment and that we send patients home with also. And the products we use are by a line called Is Clinical. They're medical grade skincare products, and I've just had really great success using their products in conjunction with this treatment. So,
But you wouldn't recommend her using her Clarisonic or
Oh, no.
any sort of manual brush?
good question. Yeah,
cleansing
so
device?
patients are always instructed to no exfoliation whatsoever for about 5 to 7 days after the treatment. Just because, you know, microneedling is a pretty aggressive treatment in itself. So doing anything else is just going to make her skin kind of like angry, you know? It's going to get angry, it's going to act out, it's not going to heal properly. So less is more when it comes to this. You know, and someone like Miranda, because as I mentioned, like she, you know, her skin is flawless. She doesn't have any lines, no scarring. She just has really beautiful skin. So she's still going to get benefits from this treatment. It's kind of, you know, it's going to be like a preventative treatment to prevent premature aging, but it's also going to just make her skin glow and appear healthy, and, you know, increases circulation. So it's really, it's a treatment that's awesome for everybody.
Now, for older skin or acneic skin, would you infuse a growth factor or anything into the skin?
Absolutely. So for a lot of treatments, I'll put a growth factor serum, and growth factors, they repair damaged or unhealthy skin cells. So I'll apply a serum over the skin and then do the treatment over that along with the hyaluronic acid serum. But also during a microneedling treatment, you know, as you saw the blood being drawn, so growth factors, your own growth factors are being produced as part of that whole wound healing response. But yeah, we use an extra growth factor serum, which just kind of boosts it. Because, you know, more growth factors, the better. So now I'm going to apply kind of a heavy application of moisturizer And those micro channels that I've created, they only stay open for like maybe 10-15 minutes after treatment. So, you know, you can't apply any makeup for, I like to tell people no makeup for the first 24 hours. You don't want to do anything that's going to cause you to sweat excessively or even really sweat at all. Because with sweat, first of all, your face may feel a little bit stingy, but also sweat, you know, and bacteria. So you want to just make sure you keep your skin really nice and clean.
So it's your excuse not to exercise today.
Right? You're welcome. And so with Miranda's face, I mean, yeah, she has some redness, but her skin handled it really, really well. How do you feel now? Because the numbing is probably wearing off or is worn off, and even once it wears off, there's really, like I was saying, you know, usually like you may feel some heat, but it doesn't hurt even once the numbing wears off. Your skin doesn't hurt.
And numbing's off of my forehead's worn off on my forehead first.
Yep.
I know we're all good.
Yeah, and that's where I took it off first too.
And so for more information on Rejuvapen or microneedling, you can always visit our website. It's WIFH.com.
Thank you so
Or
much.
you could give our office a call at 404-832-0300, and we'll be happy to answer any questions. We look forward to seeing you guys.
Thanks, guys.
Bye.
Bye.
Happy Friday. Happy St.
Happy St. Patty's Day.